add in the related conditions. So there are things that are related to arthritis. Arthritis, what is it? It is that inflammation of the joints that can cause that debilitating pain, that debilitating joint pain where it just hurts. If you've not had joint pain, it's hard to describe that achy sort of feeling that we get. But many of us do suffer from arthritis joint pain. So here are some of the stats from the US. Arthritis actually affects over 50 million Americans. That's a lot of people. 50 million, over 50 million. And then even more surprising, can you believe it actually affects 300,000 children? Who knew that arthritis affected our young people? But it does. And that's why we coin it, or we term arthritis as ageless, because it's not just like, yeah, you turn 60, it's inevitable you're going to get arthritis. That's not true. It's just that we think of arthritis going with an older person, but no, a lot of younger people are getting arthritis. There are many different causes and treatment options available for the different types of arthritis. So it's not treated exactly the same. It might not be caused by the same thing either. Good to know that. So we're going to start with the first one, which is osteoarthritis. Now, how many of us have heard of osteoarthritis? This is the most common one, osteoarthritis. We call it OA for short. This is the arthritis that is the most familiar to most of us. It is called the degenerative arthritis, which means it gets worse over time. Another term you might hear is wear and tear on your joints. That's what osteoarthritis is. It affects 27 million Americans. So almost over half of the total of arthritis in America, and we have over 100, over half of them is this OA. So with OA, what happens is you've got cartilage around your bones, right? You've got cartilage around the bones. From wear and tear and, whatever issues are going on, you wear down and wear down and wear down the cartilage until you get this. And that's the bones rubbing up against bones. It is very, very painful. I don't have to tell anybody who gets this or has bone on bone. That's the medical term we use, bone on bone. When you've got bone on bone, it is excruciating pain. It is not good. So what happens is the bones are rubbing, the joint is inflamed, there's pain and injury to the bone, and the bone, your body tries to protect your bone. So what does your body do? It starts to create what we call a callus or a bone spur. So this little thing will start growing on the bone. Now you can imagine with something protruding out how that would hurt. It's protecting the bone, but then it's now rubbing even more next to the bone next to it. And so you can imagine if you had it on the bottom of your foot and you had a callus starting to, you would be walking and you would be able to feel something, like it would feel awkward, and you'd feel like you're walking on a rock every time you took a step. So that's just your body's ability. It's trying to heal yourself, but it is not fun when you get the bone spur formations. So most common, what are some risk factors? Why do people get osteoarthritis? Why? Well, age is one of those things. As we age, you are more at risk of getting this type of arthritis. Obesity, if you are heavy, if you are carrying extra weight on your frame, which I'm carrying about extra 20 pounds on my body. The problem with that is you're putting more pressure on the joints and more pressure and wear and tear on the joints. Therefore, obesity or being overweight is a risk factor for getting osteoarthritis. What about injuries? Has anybody injured a body part and then later on developed arthritis in that joint? Anybody had that happen? I've had that. I had an injury to my left knee. I got banged in with a power cart on a golf course of all places. And after that injury and the healing, I ended up developing osteoarthritis in my knee. That's how it happened for me. It was an injury that started it. I also have family history of osteoarthritis. Does anybody have family history of osteoarthritis? My mom had osteoarthritis. So that is also a very, very big risk factor. What is the last risk factor? Joint overuse. Joint overuse. Now, when would you have joint overuse? What does that mean exactly? So let's think about it for a second. What do you think joint overuse means?
It had done at a point like I did half marathons walking. So
Yes.
that kind of came with it.
So there you go. So athletes, elite athletes, or athletes that do, the athlete could be you. It could be something that you love. Maybe you loved playing tennis as a younger person and used to play tennis a lot. You end up with tennis elbow. You could end up with joint overuse of your elbows. Walking marathons. I actually have an aunt on my husband's side. She, I don't know, I think she always has to burn off energy, but she walks marathons. Like that's what she does. She walks and walks every day. She walks, walks, walks. I feel like she's overdoing it, but again, that's not my business. But I feel that at some point she's going to wear down some of her joints because she's walking like 2, 3, 4 hours a day when the weather is nice. So she's doing a lot of that. So that's where you're going to see joint overuse in sports. What's another thing do you think that we would see joint overuse? Can you think of something else? What do you think? What about think back to our jobs, our occupations. Somebody's worked 40 years as a construction worker or 30 years as a secretary. You're doing the same movement over and over again. Remember the days of secretary? My mom was a secretary, and in school, I remember I took typing 10. In grade 10, there was a typing class to learn how to type, and we used to type not on these fancy computer things that are soft on your fingers. It was like this, you were typing on a typewriter, and there was a lot of movement. A lot of women and men ended up with arthritis in their fingers from doing their occupation. It can be occupation where you have joint overuse. What about at the grocery store, when they're constantly scanning items? It's coming to an end soon, I think. It's like everything's going to be scanned. You're going to have some chip in your head and you walk into the grocery store, put it all in your basket and you walk out and it's already paid for. Like it's coming. I think it's coming where you're not going to have to slide food over anything. It's in your cart and it computes how much it costs and it just goes onto your credit card without you having to even talk to anybody. You just grab what you want and you go through the double doors and go to your car and that's it. I think it's coming. But for right now, those grocers, they're constantly scanning. They end up with what we call carpal tunnel syndrome in our wrists.